Most people assume that if their blood tests come back normal, then they are in the clear. That normal means healthy, that nothing serious is developing inside their bodies. They walk out of the doctor's office feeling a sense of relief, a sense of security, believing that the machinery of their biology is functioning exactly as it should. But one of the most important things we have learned over the years of medical research and clinical practice is that disease does not suddenly appear when a test finally crosses a threshold. It does not wait for a number to turn red on a lab report before it begins its work. It develops slowly, quietly, often over a decade or more, while blood markers drift in the wrong direction, but remain technically within range. The uncomfortable truth is that many of the blood tests we rely on are designed to confirm disease once it is established, not to warn us when things are starting to go wrong. By the time a result is flagged as abnormal, the underlying biology has often been deteriorating for years. This is the silent epidemic of modern medicine, the gap between what we call normal and what is actually optimal for long-term human health. I am Dr. William Lee, and today I want to walk you through 5 blood markers that can predict disease long before symptoms appear. These are markers that often change early. They are sometimes checked, but they are rarely interpreted properly in a preventative context. And if you stay until the end, I will share one final marker with you that most people and most doctors have never heard of, but which may be one of the strongest predictors of long-term disease risk that we currently have. This information is not meant to replace your doctor's advice, but to empower you to have a deeper, more meaningful conversation about your health trajectory. We are going to dive deep into the science, the history, and the practical application of these markers, drawing on research from top institutions and insights from leading physicians around the world. So, the first marker is high-sensitivity C-reactive protein, or hs-CRP, and it measures something that sits in the center of almost every chronic disease, low-grade systemic inflammation. CRP is measured all the time in health systems across the globe, and it is produced by your liver in response to inflammation anywhere in the body. The high-sensitivity version of this test can detect very small amounts, levels that would not indicate an acute infection or an injury, but instead reveal chronic smoldering inflammation. This matters because chronic inflammation is not something you feel. There is no pain, there is no fever, there is no obvious sign that something is wrong. Yet it is actively contributing to the development of heart disease, stroke, type 2 diabetes, certain cancers, and dementia. Inflammation damages the lining of your blood vessels. It promotes plaque formation. It interferes with insulin signaling, and it accelerates cellular aging throughout the body. What makes this marker particularly valuable is that it often rises years or sometimes decades before any disease is diagnosed. Someone might have a high-sensitivity CRP of 3 or 4 milligrams per liter, technically within the lab's normal range of 0 to 10, and their physician sees no reason for concern. But optimal levels are actually below 1. Between 1 and 3 indicates moderate risk, and anything above 3 suggests high cardiovascular risk, even when cholesterol and blood pressure look fine. The research shows that people with chronically elevated high-sensitivity CRP, even at these seemingly modest levels, have significantly higher rates of heart attacks and strokes over the following 10 to 20 years compared to those with low levels. This was highlighted in landmark studies like the Jupiter trial, which showed that reducing inflammation could reduce cardiovascular events even in people with normal cholesterol. The challenge here is that CRP is often ordered but rarely contextualized. Doctors check it, they see it is not dramatically elevated like it would be in an acute illness, and they move on. What gets missed is the pattern. A single reading alone does not tell you much, because CRP can spike temporarily with a cold, with an injury, or even just intense exercise. What matters is the trend over time. If someone's CRP is consistently sitting at 2, 3, or 4 across multiple tests months apart, well, that is chronic inflammation, and it is driving disease processes silently in the background. Leading experts like Dr. Mark Hyman have often spoken about inflammation as the root cause of most modern illnesses, suggesting that managing it through diet is crucial. Foods high in sugar, refined carbohydrates, and trans fats can drive this inflammation up, while omega-3 fatty acids, leafy greens, and polyphenol-rich foods can help bring it down. It is not just about taking a pill, it is about changing the internal environment of your body. When you understand that your body is constantly signaling its state through these proteins, you begin to see health not as a static state, but as a dynamic balance. You have to ask yourself, what is feeding the fire inside you? Is it stress? Is it poor sleep? Is it the food on your plate? By tracking HSCRP, you get a window into that fire, you can see if your lifestyle changes are actually working. If you start a new exercise regimen or change your diet and your CRP goes down, you have biological proof that you are moving in the right direction. If it stays high, you know you need to dig deeper. Maybe there is hidden dental infection. Maybe there is gut dysbiosis. Maybe there is chronic stress keeping your cortisol elevated. This marker is a compass. It does not tell you exactly where the treasure is, but it tells you which direction is north. And in the landscape of preventative health, knowing which direction is north can save your life. It is crucial to remember that inflammation is not inherently bad. Acute inflammation is how your body heals a wound or fights off a virus. The problem is when the switch gets stuck in the on position. Now, this is what we call inflammaging, a term coined by researchers to describe the chronic low-grade inflammation that accelerates aging. By monitoring HSCRP, you are monitoring your aging process itself. You are looking at the wear and tear on your system before the engine fails. This is the essence of preventative medicine. It is about seeing the smoke before the fire burns down the house. Many people wait until they have chest pain before they worry about their heart. By then, the arteries may be significantly blocked, but if their HSCRP had been trending up for 5 years, they could have intervened. They could have changed their diet, managed their stress, improved their sleep, and potentially avoided the crisis entirely. This is why we must shift our mindset from sick care to health care. We must stop waiting for the diagnosis and start listening to the signals. The data is there. The tests are available. The question is whether we are willing to look at them with fresh eyes. The second marker takes us to metabolism, and it is one that hardly anyone has checked, despite being extraordinarily predictive, and that is fasting insulin. When you eat, your blood sugar rises. We know that, and your pancreas releases insulin to move that glucose into your cells. In a healthy person, this happens efficiently with relatively modest amounts of insulin, but when cells become resistant to insulin signal, your pancreas has to produce more and more insulin to achieve the same blood sugar control. For years, sometimes decades, your pancreas can keep up with this demand, and your blood sugar remains completely normal. That is the critical point. Normal glucose does not mean healthy metabolism. This is a concept that Dr. Peter Attia has discussed extensively in his work on longevity. He emphasizes that insulin resistance is the precursor to almost all metabolic disease. Fasting insulin reveals how hard your pancreas is working behind the scenes. Someone might have a fasting glucose of 5 millimoles per liter, well within the normal range, but need a fasting insulin of 15 to 20 microunits per milliliter to maintain it. Ideally, fasting insulin should be below 7 and certainly below 10. When it starts creeping up into the teens or higher, that is a clear sign of insulin resistance. Even though standard diabetes screening like fasting glucose or HbA1c will still come back reassuringly normal, elevated fasting insulin predicts type 2 diabetes years before blood sugar rises. It predicts cardiovascular disease independently of cholesterol levels. Emerging evidence also links it to Alzheimer's disease, with some researchers now describing Alzheimer's as type 3 diabetes because of how profoundly insulin resistance affects your brain function. The tragedy is that insulin resistance is reversible in its early stages through diet, through exercise, and lifestyle changes. But by the time someone is diagnosed with diabetes based on elevated glucose, significant damage has already occurred. The pancreas is struggling. Your beta cells, where your insulin comes from, are dying, and reversal becomes much more difficult. The reason fasting insulin is not routinely checked is partly cost and partly convention. Most healthcare systems are designed around diagnosing disease, not preventing it. Glucose and HbA1c are cheap, standardized, and sufficient for diabetes diagnosis. So that is what we get. But if you are interested in catching metabolic dysfunction early, then fasting insulin is one of the most valuable markers you can ask for. Think about the mechanics of this. Insulin is a storage hormone. When it is high, your body is in storage mode. It is very difficult to burn fat when insulin is elevated. This is why so many people struggle to lose weight despite eating less and moving more. Their insulin levels are locking their fat cells. By measuring fasting insulin, you understand why your body is resisting weight loss. It is not a lack of willpower, it is a hormonal imbalance. Dr. Jason Fung, a nephrologist who specializes in intermittent fasting, has written extensively about how lowering insulin levels can unlock weight loss and reverse diabetes. He argues that we treat the symptom high blood sugar, but ignore the cause high insulin. When you focus on lowering insulin through dietary strategies like reducing refined carbohydrates, practicing time-restricted eating, or increasing healthy fats, you address the root cause. You give your pancreas a break. You allow your cells to regain sensitivity. This is not just about avoiding diabetes, it is about energy. Insulin resistance makes you tired, it causes brain fog, it leads to cravings. When you fix your insulin sensitivity, you get your energy back. You feel clearer, you feel more stable. This is why fasting insulin is a marker of vitality, not just disease risk. It tells you how flexible your metabolism is. Can your body switch between burning sugar and burning fat? Or is it stuck? When you request this test, you are asking for a deeper look into your engine. You are asking, how efficiently am I running? And the answer can change everything. Imagine knowing 5 years before a diabetes diagnosis that your insulin was creeping up. You could have changed your trajectory. You could have avoided the medications, the complications, the fear. That is the power of this marker. It gives you time. And in health, time is the most valuable currency we have. We often think of metabolism as something fixed, something determined by genetics, but the science shows us it is plastic. It changes based on what we do. Fasting insulin is the report card on those changes. It tells you if your lifestyle is supporting your biology or fighting against it. And unlike glucose, which can fluctuate wildly based on what you ate for breakfast, fasting insulin is a stable reflection of your baseline hormonal state. It is the quiet hum of your metabolic engine. If it is revving too high, you know there is trouble ahead. You need to adjust the fuel. You need to adjust the load. This is proactive health management. This is taking the wheel. Moving on to the third marker, and we need to talk about apolipoprotein B or ApoB, because this single measurement tells you more about your actual cardiovascular risk than LDL cholesterol ever could. So ApoB is a protein that sits on the surface of every particle capable of causing atherosclerosis. Each of these particles has exactly one ApoB molecule, which means measuring ApoB directly counts how many atherogenic particles are in your blood. This is fundamentally different from measuring LDL cholesterol, which tells you the amount of cholesterol being carried but not how many particles are carrying it. The distinction matters because it is the particles themselves, not the cholesterol inside them, that penetrate artery walls and form plaques. You could have two people with identical LDL cholesterol levels, but one might have many small dense particles while the other has fewer larger ones. The person with more particles, higher ApoB, has significantly higher cardiovascular risk despite having the same LDL number. Studies consistently show that ApoB predicts heart attacks and strokes more accurately than LDL cholesterol alone, particularly in people with insulin resistance where particle numbers and cholesterol content often do not align. Optimal ApoB levels are generally below 0.9 grams per liter, with anything above 1.2 indicating moderate to high risk. Yet, ApoB is rarely checked. Most lipid profiles do not include it. Doctors focus on LDL alone. They make treatment decisions based on LDL and often miss people who have acceptable LDL but dangerously elevated ApoB. Someone could be reassured that their cholesterol is fine whilst having genuinely high cardiovascular risk, or on the other hand, prescribe statins for moderately elevated LDL when the particle number is actually low and does not warrant treatment. For anyone with metabolic dysfunction, family history of heart disease, or existing risk factors, requesting ApoB alongside standard lipids provides clarity that LDL simply cannot. It is a more accurate measure of what actually is driving plaque formation in your arteries. And knowing your number changes how aggressively you need to address your cardiovascular risk. This concept has been championed by lipidologists around the world who argue that ApoB is the gold standard for risk assessment. The mechanism is physical. Think of the particles as cars on a highway. LDL cholesterol is the total weight of the cargo in the cars. ApoB is the number of cars. If you have many small cars carrying little cargo, the weight might be low, but the traffic congestion is high. That congestion is what clogs the arteries. That is what causes the crash. By counting the cars, you get a true picture of the traffic. This is why two people with the same LDL can have vastly different risks. One has light traffic, the other has a gridlock. And gridlock leads to accidents. When you understand this, you stop obsessing over total cholesterol and start looking at particle count. You realize that the quality of your lipids matters more than the quantity. This shifts the conversation from simply lowering numbers to improving particle quality. Diet plays a huge role here. Reducing saturated fats, increasing fiber, and managing insulin resistance can all help lower ApoB. It is not just about taking a statin. It is about changing the composition of your blood. Some people are genetically predisposed to having more particles. For them, knowing their ApoB is critical. It might mean they need to be more aggressive with lifestyle changes or earlier with medication. But without the test, they are flying blind. They are guessing, and guessing with your heart is not a strategy we should accept. We have the technology to count the particles. We have the science to understand the risk. We just need the will to use it. This is about precision medicine. It is about treating the patient in front of you, not the average patient in a textbook. Your arteries are unique. Your risk is unique. Your ApoB tells your story. It tells you how much material is available to build plaque. It tells you the potential for future blockage. And because it changes slower than triglycerides or glucose, it is a stable marker of long-term risk. It is the foundation of your cardiovascular health. If you build your house on a foundation of high ApoB, it does not matter how well you eat otherwise. The structure is at risk. But if you lower that foundation, you build stability, you build longevity, you build a heart that can last a lifetime. This is why we advocate for this test. It is not to create anxiety. It is to create clarity. It is to remove the guesswork from heart health. And in a world where heart disease remains the #1 killer, clarity is survival. The fourth marker is one that bridges cardiovascular health and brain health. Yet, it is almost never ever included in routine blood panels, and this is homocysteine. So homocysteine is an amino acid produced during the metabolism of methionine, another amino acid found in protein. Under normal circumstances, homocysteine is rapidly converted into other useful compounds through a process called methylation, which requires B vitamins, specifically B12, B6, and folate. When you are deficient in these vitamins, or when methylation is impaired for genetic or lifestyle reasons, homocysteine accumulates in your blood. Elevated homocysteine is directly toxic to blood vessels, causing endothelial dysfunction, promoting blood clot formation, and accelerating atherosclerosis. The research on homocysteine is really compelling. We know that higher levels are associated with increased risk of heart attacks, of strokes, of peripheral artery disease, and all-cause mortality. But beyond cardiovascular risk, homocysteine also appears to accelerate brain shrinkage and cognitive decline. Studies have shown that people with elevated homocysteine in midlife have significantly higher rates of dementia decades later, and brain imaging actually reveals faster atrophy in areas critical for memory. The mechanism likely involves both vascular damage, which reduces blood flow to the brain, and direct neurotoxic effects on the brain cells. What makes homocysteine particularly valuable as a marker is that it is modifiable. If your homocysteine is elevated, generally anything above 10 to 12 micromoles per liter, this warrants attention. Supplementing with B vitamins, particularly methylated forms like methylfolate or methylcobalamin, can bring it down relatively quickly. Unlike many other markers that require months of lifestyle changes, homocysteine responds within weeks to targeted supplementation. Despite this, it is rarely checked, and when it is checked and found to be high, it is just often dismissed because there is no pharmaceutical drug specifically designed to lower it. The intervention is nutritional, not pharmaceutical, which places it outside the standard medical playbook. This is a critical point. Medicine often ignores problems it cannot solve with a pill. But homocysteine can be solved with nutrients. It is a testament to the power of nutrition in disease prevention. Dr. David Perlmutter, a neurologist and author of Grain Brain, has highlighted the connection between homocysteine, inflammation, and brain health. He argues that protecting the brain starts with protecting the blood vessels that feed it. High homocysteine damages those vessels. It creates leaks. It creates stiffness, and the brain suffers. But it also damages the neurons directly. It interferes with DNA repair. It promotes oxidative stress. So lowering homocysteine is a double protection. It protects the pipes and the property. This is why testing is so important. Many people are deficient in B vitamins without knowing it. Especially as we age, our ability to absorb B12 decreases. Stomach acid declines. Medications like proton pump inhibitors block absorption. So even if you eat well, your levels might be low, and your homocysteine rises. It is a silent thief of cognitive function. By checking this marker, you can catch the deficiency before the memory loss begins. You can supplement strategically. You can support your methylation pathways. This is not just about avoiding dementia, it is about maintaining sharpness. It is about keeping your mind clear as you age. Everyone wants to live long, but few want to live long with a declining mind. Homocysteine gives you a lever to pull to protect your cognition. It is actionable, it is solvable, and yet it is overlooked. This is the gap we are trying to fill. We want you to know what is possible. We want you to know that brain health is not just luck. It is biology, and biology can be managed. When you see your homocysteine number, you see your brain's vulnerability, you see the wear on your vascular system, and you have the tools to fix it. Vitamins are not magic, but in this case, they are medicine. They are the cofactors your body needs to clean up this toxic byproduct. Without them, the trash piles up. With them, the system runs clean. This is the beauty of functional medicine. It looks for the root cause, it looks for the missing piece, and often the missing piece is a vitamin. But you have to know to look for it. You have to ask for the test. You have to demand the data, because your brain is worth it. Your memory is worth it. Your future self is worth it. Do not let a simple blood test go unchecked when it could hold the key to your cognitive longevity. Moving on to the fifth marker, and this is one that you are likely to be familiar with if you have ever had diabetes screening, and that is HbA1c or A1c, which measures your average blood sugar over the past 2 to 3 months by looking at how much glucose has attached to your red blood cells. Most people know that HbA1c is a diabetes diagnostic tool. A level below 42 is considered normal, 42 to 47 is prediabetes, and 48 or above is diagnostic for type 2 diabetes in many regions. But focusing only on these thresholds completely misses the point from a prevention perspective. What matters is not just whether you are above or below the diagnostic cutoff, but where your HbA1c sits within the normal range and how it is changing over time. Someone whose A1c consistently sits at 36 or 37 is in a very different metabolic state than someone whose A1c sits in the level of 40 or 41, even though both are technically normal. Now, that difference reflects chronic glucose exposure, which drives a process called glycation, the attachment of glucose molecules to proteins throughout your body. What we know is that glycation damages blood vessels, it contributes to arterial stiffness, it impairs your kidney function, and accelerates aging at the cellular level. Higher HbA1c within this normal range predicts cardiovascular disease, chronic kidney disease, peripheral neuropathy, and cognitive decline, independently of whether someone ever develops diabetes. Beyond the absolute number, the trajectory matters enormously. If you look at someone's HbA1c over 5 or 10 years, and it is gradually creeping up, then that is a clear signal that metabolic control is slipping. Even though every single test result was labeled as normal, that upward drift reflects worsening insulin resistance, declining pancreatic function, and increasing glycation damage throughout the body. Catching this early when HbA1c is still in the mid to high 30s but trending upwards gives you years to intervene before irreversible damage accumulates. The problem is that HbA1c is used as a binary diagnostic tool. You either have diabetes or you do not. The nuance of optimal versus acceptable versus concerning but still normal is lost. Nobody celebrates keeping HbA1c in the low 30s or worries about a gradual rise from 35 to 40 over a decade. Yet, that trajectory is profoundly predictive of future disease. This is where tracking your own results over time becomes invaluable because the pattern reveals far more than any single test. Dr. Mark Hyman often refers to this as the spectrum of metabolic health. He argues that we are all on a spectrum from optimal metabolic function to full-blown diabetes. Most people are somewhere in the middle in a state of diabesity or pre-diabetes that goes undetected. By looking at the trend of your HbA1c, you can see where you are on that spectrum. Are you moving towards health or towards disease? This is empowering. It puts you in the driver's seat. You are not waiting for the crash. You are watching the speedometer. If the needle is creeping up, you slow down. You change your fuel. You adjust your path. This is how you avoid the destination of chronic disease. Glycation is also known as aging. When sugar sticks to proteins, it makes them stiff. It makes your skin wrinkle. It makes your arteries hard. It makes your organs less flexible. So your HbA1c is literally a measure of how fast you are aging internally. A lower HbA1c means slower aging. A rising HbA1c means accelerated aging. This is why optimal levels are so important. We do not want to be just normal. We want to be optimal. We want to be in the range that supports longevity, not just survival. And this requires vigilance. It requires looking at your history. It requires keeping records. Do not let your results disappear into a medical file. Keep them, track them, compare them, look for the trend. The trend is the truth. A single number can be a fluke. A trend is a pattern, and patterns predict the future. If your pattern is upward, you have work to do. If your pattern is stable or downward, you are on the right path. This is the science of self-management. It is using data to drive decisions. It is taking responsibility for your biology, and it is the most effective way to stay healthy in the modern world. We are surrounded by factors that push our blood sugar up. Stress, poor sleep, processed food, sedentary behavior. These forces are constant. Your HbA1c tells you if you are resisting them successfully. It tells you if your defenses are holding. And if they are not, you know you need to reinforce them. You need to strengthen your metabolism. You need to protect your cells. This is a lifelong process. It is not a one-time fix. It is a continuous adjustment. And HbA1c is your guide. It is the map that shows you the terrain. Follow the map. Respect the data, and you will arrive at a healthier destination.